Good morning. Today we're going to talk about pancreatic adenocarcinoma complications. First, we gotta know what is the pancreas. The pancreatic cancer begins in the tissues of pancreas, an organ in your abdomen that lies horizontal behind the lower part of the stomach. Your pancreas secretes enzymes that aid digestion and hormones that help regulate the metabolism of sugars. Reasons why pancreatic cancer lead the causes of cancer death. Pancreatic cancer often has a poor prognosis, even when diagnosed early. Pancreatic cancer typically spreads rapidly and is seldom detected in an early stage, which is a major reason why it is leading causes of the cancer death. Signs and symptoms may not appear until pancreatic cancer is quite advanced and complete surgical removal is impossible.
The cancer is really cells growing out of control. So when a cell grows in an organ, it's controlled by the organ. It's told what to do. It says, you're part of the liver, you should develop into a liver cell, and this is what you should be doing. Similarly in the pancreas.
Now, symptoms we have: upper abdominal pain that may radiate to your back, yellowing of your skin and the white of your eyes, loss of appetite, weight loss, depression, and blood clots. How pancreatic cancer forms. Pancreatic cancer occurs when cells in your pancreas develops mutation in your DNA. This mutation causes cells to grow uncontrollably and to continue living after normal cells will die. These accumulated cells can form tumors. Most pancreatic cancer begins in the cell that lines the ducts of the pancreas. This type of cancer is called pancreatic adenocarcinoma or pancreatic exocrine cancer. Rarely, cancer can form in the hormone-producing cells of the pancreas. This type of cancer is called islet cell cancer and pancreatic endocrine cancer.
I was working full-time in a kitchen in a restaurant. My backache, my stomach cramps, things like that. I put down the menopause, the job I was doing, sort of you've always got an excuse. And then I started getting really just feeling nauseous all the time. And
Now, recent factors. Factors that may increase the risk of pancreatic cancer include African American race, excessive body weight, chronic inflammation of the pancreas, pancreatitis, diabetes, family history of genetic syndrome that can increase cancer risks, including BRCA2 gene mutation, Lynch syndrome and family atypical mole malignant melanoma, FAM, personal and family history of pancreatic cancer, and smoking.
With pancreatic cancer, a lot of times patients may have feelings of indigestion or bloating, sometimes an increased sense of fullness, and there's many things we can use from a naturopathic.
Complications, we get jaundice, pain, bowel obstruction, and weight loss. Treatment and drugs. The surgery for tumors in the pancreatic head, surgery for tumors in the pancreatic tail and body. Radiation therapy, chemotherapy, targeted therapy, clinical trials. In conclusion, pancreatic cancer is one of the most deadly cancer types. It is not curable disease and it is one of the most painful diseases. Thank you for watching.